The fluorescent lights hummed their monotonous prayer above Pediatric Bay 4 at Oak Creek Memorial, the kind of sound that burrowed into your bones after enough years. Ashley Cooper's hands moved across the fall line with practiced efficiency, adjusting the flow rate on the saline drip feeding into 8-year-old Marcus Hayes' thin arm. Her fingers trembled, not from nervousness, but from the effort of containment, the constant discipline of staying invisible. Nobody noticed a tremor in a nurse's hands. Nobody asked questions about muscle memory that shouldn't exist in any official record. She'd been a nurse here for 3 years. Before that, nothing. The record showed a gap, a blank space where a name used to be. Operation Copper Dawn. Classified until it wasn't, and by then she'd already learned that some erasures were permanent. Marcus lay motionless on the mattress, his unseeing eyes fixed on a point somewhere beyond the ceiling tiles. Blind since birth. But the blindness wasn't what had brought him to Denver, to this particular hospital, to Dr. Sterling's reputation. It was something else, a sudden neurological deterioration that had started 8 months ago and progressed like a thief in the dark, stealing function one system at a time. 20 different neurologists across the country. 20 different verdicts, all identical. All final. His sodium levels are stable, Ashley said quietly, reading the monitor. She kept her voice at the frequency doctors preferred from nurses, audible enough to register, soft enough to ignore. Last blood work came back 40 minutes ago. Commander David Hayes sat in the vinyl chair beside his son's bed, his dress blues immaculate even at the edges of exhaustion. The man hadn't slept properly in months, you could read it in the way he held his shoulders, like he was bracing against an invisible impact. His blind son. His only son. His last son, according to the folder Ashley had read in the break room when nobody was watching. 2 daughters, both grown. This one, Marcus, was the gift that had arrived late in the commander's life, and Marcus had arrived blind, and now Marcus was dying, and the medical system had unanimously decided that death was the only logical outcome. Ashley adjusted the monitor leads. The boy's heart rhythm looked steady on the screen, a gentle sine wave that suggested a body still trying, still fighting. Sinus rhythm. Normal. Everything about his vitals was normal. That was the part that didn't fit with the 20 doctors' consensus, but Ashley had learned long ago that what didn't fit was often the most important information. Dr. Sterling entered Bay 4 like he was entering a stage. He moved with the particular grace of a man who'd spent a decade rehearsing his own importance. Polished shoes clicked against the tile floor, click, 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 a rhythm that made even the machine seem to pause and listen. His white coat was pristine, pressed with the kind of care that suggested he'd changed it between appointments specifically to maintain that appearance. 43 years old, handsome in the way expensive dermatology and an exclusive gym membership could produce, with silver threading through his dark hair at exactly the right temples. He was the chief of pediatrics at Oak Creek Memorial. More importantly, he was the voice of authority in a hospital where authority translated directly to reputation, and reputation translated to surgical volume, and volume translated to book deals and speaking engagements and consulting fees that made his actual salary seem like pocket change. Dr. Sterling's eye swept across the room, Bay 4, Patient Hayes, Marine Commander Hayes, all of it registering in the way data registered to someone whose mind was already 6 steps ahead. His gaze landed briefly on Ashley, the way a person might glance at the 4-stand or the heart monitor. Furniture. An asset without agency. Commander, he said, his voice warm as heated cream. Good morning. I wanted to check in before our conference. Conference. Commander Hayes stood, extending his hand. The man was a professional at hope, you could hear it in his voice, that careful calibration between gratitude and desperation. This morning. 10 a.m. We're bringing in our attending team, 17 specialists across neurology, cardiology, immunology, and metabolic disease. We'll review Marcus's case comprehensively. Dr. Sterling's smile was calculated to convey both confidence and compassion. It's standard protocol for complex pediatric cases. Ashley continued her work on the 4-line, her movement smaller now, less present. This was the choreography she'd perfected over 3 years, being in the room while somehow not being in the room. being seen while remaining invisible. But something was wrong. She could feel it the way she could feel air pressure changes in her sinuses, the way a body recognizes when it's being aimed at. Something about Marcus's presentation didn't match the 20-doctor consensus. The blind boy's EKG was too steady. His oxygen saturation was too stable. The peripheral edema in his legs, just slightly present this morning, suggested fluid distribution, but his lung sounds were clear. Clear. A child with progressive neurological decline wasn't supposed to have clear lungs. She'd read his chart for times in the past 2 days. 20 physicians, all of them reaching the same conclusion: progressive neurological degenerative disease. Incurable. Terminal. The prognosis window was 6 months, maybe less. Start palliative care conversations. Begin thinking about end-of-life comfort measures. But the chart wasn't correlating with the patient. Marcus, Dr. Sterling said, approaching the bed with the kind of warmth reserved for cameras and family members. "How are we feeling today?" The boy didn't respond. Blind children learned early not to waste energy on people they couldn't see. Ashley finished adjusting before rate. The saline line was running at 125 milliliters per hour, appropriate for a child of Marcus's size. She noted it on the monitor, her movements practiced, efficient, invisible. Her hands, scarred from things that existed in redacted documents, moved like a surgical laser through the routine. Dr. Sterling turned back to Commander Hayes. "We'll have a more complete picture after the conference. I'm cautiously optimistic that our team will identify something the previous physicians may have missed. Oak Creek has resources that most regional facilities simply don't have access to." Ashley felt the word settle like scar tissue. Cautiously optimistic. Translation: he was going to be the hero. He was going to catch what 20 other doctors had missed. He was going to save the commander's blind son, and when he did, the hospital was going to celebrate him, the media was going to celebrate him, and his consulting fees were going to triple. That was the moment she knew. Not consciously. Not yet. But her body recognized it, the shift in the room's energy, the way predators recognize other predators. Dr. Sterling was not here to help Marcus Hayes. Dr. Sterling was here to use Marcus Hayes. "I want you to feel confident that your son is receiving the highest level of care," Dr. Sterling continued, and every word was true in the way professional lies were always technically true. True in letter. False in spirit. Commander Hayes nodded, and the relief in his face was visible, the kind of visible relief that came from handing your son's life to someone who promised to carry it. "Thank you, Doctor. That means everything." After Dr. Sterling left, click, click, click on the tile, his footsteps fading toward the hallway, the bay fell quiet except for the ventilation system's whisper and the steady beep of Marcus's heart monitor. The boy lay motionless, his small chest rising and falling, his eyes fixed on nothing. Ashley stayed at the bedside a moment longer than necessary. She reached for Marcus's wrist and felt his pulse, strong, regular, rhythmic. 102 beats per minute, appropriate for a child his age. The pulse of someone fighting. The pulse of someone not dying. Her hands trembled as she documented the vitals in the chart. Not from fear. From the effort of staying quiet. From the knowledge that she'd seen something the conference room wasn't going to see. From the understanding that if she spoke that knowledge aloud, the sentence would end with her termination. Because Oak Creek Memorial didn't hire nurses to think. It hired them to execute orders from physicians like Dr. Sterling, who had book deals and speaking engagements and the kind of reputation that required very specific, very profitable outcomes. But that wasn't the worst part. The worst part was that Marcus needed someone to think. Marcus needed someone to notice the contradiction between the chart and the body, between the consensus and the actual child lying in the bed. Marcus needed someone willing to risk everything on the possibility that 20 doctors could all be wrong. Ashley pulled her hands back from the bedside and stepped away. She'd survived Baghdad. She'd survived black sites and redactions and an entire military branch dedicated to forgetting she existed. She had learned, through methods both deliberate and traumatic, that survival sometimes meant accepting the unacceptable. Survival sometimes meant watching. She pressed the call button to signal that Bay 4's morning assessment was complete. Then she returned to her station, where the other nurses pretended not to see her, where the charts waited to be documented, where 3 years of invisibility had prepared her for this exact moment, watching a sick child get buried under the weight of institutional reputation. The fluorescent lights hummed on, indifferent. The conference room at Oak Creek Memorial held 37 people, residents, fellows, attending physicians, the department heads from neurology and cardiology, and in the back corner, Commander David Hayes, his hand resting on his son's shoulder as the boy sat in a wheelchair, eyes fixed on nothing. The fluorescent panels cast everything in clinical white. Dr. Sterling stood at the projector, his tie perfectly knotted, his smile the smile of a man who had already won. He clicked to the next slide. Marcus Hayes's brain MRI filled the wall behind him, axial cuts showing the ventricles, the cortex, the delicate architecture of an 8-year-old's mind. Then the next, spinal cord imaging. Then cardiac echo. Then metabolic panel. 40 images, each one annotated with Dr. Sterling's careful handwriting. 20 neurologists, Dr. Sterling said, his voice carrying the weight of certainty. Mayo Clinic, Johns Hopkins, Boston Children's, Seattle Children's. 20 expert opinions. All identical. He turned to face the room, letting the silence settle like snow. The consensus is irreversible neurological decline. Rapid onset, non-responsive to intervention. The appropriate course is comfort care measures only. Pain management. Dignity in his final weeks. He glanced at Commander Hayes, and his expression shifted into something that looked like compassion but moved like a knife. This young man is not a puzzle to be solved, people. He is a patient we honor by accepting reality. Ashley stood near the doorway, her badge clipped to her scrubs beneath a name that wasn't hers. 3 years at Oak Creek. 3 years of being the nurse who stayed late, who caught medication errors before they reached patients, who could read a monitor stripped the way other people read faces. 3 years of being invisible. She had pulled up Marcus's vitals that morning while he slept, heart rate 82, blood pressure 118/74, oxygen saturation 98% on room air. But his heart sounds had a quality she recognized, a muffled quality, as if something was pressing inward. And his neck veins. Slightly distended. Not enough for the residents to notice. Not enough for the echo to flag. But enough. She raised her hand slightly. Dr. Sterling. He turned, his expression already arranged into patience, the expression a teacher uses with a student asking about something that was obviously covered. The residents watched. Some of them looked away. Some of them waited. One more imaging protocol, Ashley said quietly. Contrast MRI focused on the posterior fossa and pericardial space. There's fluid accumulation that doesn't match the neurological pattern. The cardiac sounds are. Dr. Sterling's smile became something surgical. The room's temperature seemed to drop 5 degrees. Nurse Cooper, he said, and the name sounded like a category, like a label on a file. Florence Nightingale over here. Let me explain how medicine actually works. He moved closer, his voice becoming a demonstration for the audience. Nurses take vitals. Nurses document intake and output. Nurses ensure patient comfort. Doctors diagnose. Doctors interpret imaging. Doctors make clinical decisions. He gestured to the wall of scans behind him like a conductor before an orchestra. 20 neurologists have reviewed this case. Mayo Clinic. Johns Hopkins. Specialists who have forgotten more about the human nervous system than you will ever know. But please? His eyes locked on hers, and she felt every resident in the room lean imperceptibly forward. Please, enlighten us with your nursing intuition. Laughter flickered across the room like a flame catching dry paper. Someone coughed. The sound of it moved through the crowd, gaining momentum, becoming something that felt like permission. Ashley didn't flinch. She didn't lower her hand. She met his eyes and held them for exactly 3 seconds, then turned and walked toward the hallway. Behind her, Dr. Sterling was already turning back to the projector, already dismissing her from the landscape of his attention. The hallway was empty except for the hum of the hack system and the distant beeping of monitors. She heard the marker before she saw him, the squeak of the permanent marker against the unit board, the one that held announcements and schedule changes and, occasionally, personnel matters. Dr. Sterling wrote in large, careful letters, A. Cooper, insubordination. Overstepping scope of practice. Written warning. His handwriting was beautiful, precise. The kind of handwriting that looked good in court. 30 minutes later, he called her into Marcus's room. The boy lay in his hospital bed, his small frame nearly lost in the white sheet, his eyes open but unseeing. Commander Hayes stood beside him, 6'2" of Marine, his uniform pressed, his posture rigid with the discipline of 23 years of service. He looked at Ashley as she entered, and she saw the calculation in his face. This was the nurse who had suggested something more. This was the nurse who had challenged the consensus. Dr. Sterling closed the door softly behind her. Commander Hayes deserves to understand our chain of command here at Oak Creek, he said, his voice gentle now, reasonable, the voice of someone explaining something obvious to someone who should already know. In this hospital, as in the military, there is a hierarchy. Information flows through appropriate channels. Diagnosis happens at the attending level. Recommendations come through the chain. He paused, letting the weight of his words settle. Nurses follow orders, Nurse Cooper. They don't give them. Your job is to empty bedpans and update charts and provide comfort measures. Not to play doctor. Not to second-guess 20 of the country's leading neurologists. He smiled at Commander Hayes. I'm sure you understand, sir. Discipline. Structure. That's how we keep patients safe. Commander Hayes nodded slowly, though something in his expression remained uncertain. Ashley took one measured breath. She had learned how to do this in Baghdad, in a forward surgical site where the morphine supply was limited and the casualties were infinite, how to control her body's response to adrenaline, how to keep her hand steady and her voice level. She felt the anger rise in her chest, felt it move through her blood like heat, and she pressed it down with the same precision she had once used to pack a sucking chest wound. A single tear escaped her left eye. Not from sadness. From the effort of holding herself in place. She wiped it without breaking eye contact with Dr. Sterling, her hand moving in one smooth motion, her voice when she spoke carrying no tremor, no break, no apology. 20 doctors missed it, Dr. Sterling. Maybe 21 will too. The room went very quiet. Even the monitors seemed to pause in their beeping. Dr. Sterling's face remained pleasant, professional, unmoved. We'll discuss this with HR, he said, and turned back to his tablet. The break room was a narrow space with a refrigerator that hummed constantly and a coffee maker that produced something vaguely the color and texture of coffee. Ashley sat at the table with a cup, her hands wrapped around the warmth, and waited for someone to join her. Sarah, who had been kind during the first months. Martinez, who had covered her shifts when Jacob was sick. Chen, who had taught her the hospital's medication system when she first arrived. They came in, one by one, saw her sitting there, and left. Sarah didn't even grab her coffee. Martinez made a small sound, something apologetic, and turned toward the door. Chen looked at the table for a moment, then at Ashley's face, then away. The room filled with silence, the thick kind, the kind that had weight and texture. And then, from the hallway, Dr. Sterling's laughter. Not angry. Not loud. Just the comfortable laughter of a man who had already won, moving past a minor inconvenience. Some people forget their place, his voice carried through the thin walls. Ashley stared down at her black coffee and saw Baghdad in the reflection, dust and blood and the face of a 17-year-old boy who had stepped on an IED and whose leg she had tourniqueted with her own combat gauze while the surgeon was 8 minutes away and everything depended on keeping him alive long enough. She saw the faded unit patch she had sewn inside her jacket lining, the one with the insignia she was not supposed to have, was not officially supposed to remember, the one that marked her as something she had stopped being. Or thought she had. She looked up through the break room doorway, through the gap where Dr. Sterling had moved past, where she could still see his back, see him laughing with the residents, see him already thinking about his next patient, his next triumph, his next opportunity to distinguish himself. Their eyes didn't meet. But she made sure her voice was steady enough that it carried down the hallway, quiet enough that only someone listening carefully would hear it, calm enough that it sounded like a statement of fact rather than a threat. 20 doctors missed it, she said. Maybe 21 will too. Jacob's text arrived at 14:13, buzzing against Ashley's thigh in her scrub pocket as she adjusted Marcus Hayes's for line. "Mom, you okay?" Heard Commander Hayes is Marcus's dad. That's wild. She read it once, memorized it, and let the phone go dark without responding. Commander Hayes was still here, a third day running, sitting in the corner chair with his hand on his son's bed rail, his other hand tracking movement by sound alone. He had the bearing of someone used to making decisions under fire, which meant he was reading the room like a tactical briefing, how the nurses moved around his son, which monitors got checked and which got ignored, whether the doctors actually knew what they were doing or were just performing confidence for an audience. Ashley already knew he'd figured out the latter. The monitors showed what they'd always shown to anyone paying actual attention. Marcus's heart rate was steady but elevated, 101, not critical but elevated. His oxygen saturation held at 94, which looked normal on the surface until you understood what normal meant in context. A healthy child sat should be 97 to 100 without effort. 94 meant the lungs were working harder than they should. But it wasn't the saturation that caught Ashley's eye during the morning rounds. It was the subtle shift in the QRS complex on the cardiac monitor, a flattening of the voltage that shouldn't exist in a healthy 8-year-old heart. Electrical alternans. Every other heartbeat slightly weaker than the baseline. That pattern had a name. That pattern meant something was compressing the heart. Dr. Sterling swept through at 10:15 with his entourage of 3 medical students who looked terrified and 1 resident who looked like she'd learned to smile through disappointment. Still no change, he announced to the room, gesturing at Marcus as though the boy weren't lying right there, conscious and listening. The neurological decline is consistent with progressive mitochondrial dysfunction. At this point, comfort measures are the appropriate. His diastolic pressure, Ashley said, not looking up from the cardiac monitor, dropped 4 millimeters of mercury from yesterday. The room went quiet. The kind of quiet that happens when someone speaks out of turn and everyone remembers that this particular someone was already written up for insubordination. Dr. Sterling's eyes found her. Cold. Controlled. I'm sorry. Diastolic 58 today. 62 yesterday. Ashley pulled up the trend data on the monitor without urgency. The pattern's accelerating. Pulsus paradoxus might be present but subtle with his baseline elevation. Commander Hayes's hand tightened on the bed rail. Not much, just enough that Ashley heard the leather of his watch creak. Dr. Sterling moved closer, lowering his voice with the precision of someone about to deliver a threat disguised as a teaching moment. Nurse Cooper, you were very clear yesterday that you understand the scope of your practice. Vital sign interpretation belongs to physicians. What you're experiencing is confirmation bias. You want to find something wrong because you think you know better than 20 different doctors across 4 different states. I'm not interpreting, Ashley said, meeting his eyes with the flatness of a practitioner in triage mode. I'm reading what the monitor displays. The interpretation is yours. She'd made a mistake. Not a tactical mistake, a mistake in showing she wouldn't break. In his world, submission was currency, and she'd just announced she wasn't trading. Dr. Sterling straightened, nodded once to his medical students, and moved toward the door. Document your concerns if you'd like, he said without turning around. Though I'd recommend reviewing the chart notes from the previous 20 physicians who've examined this patient. Sometimes professionals need to learn when to accept expertise beyond their training. The residents followed like remoras trailing a shark. The door closed. The machines beeped their steady algorithms. Commander Hayes hadn't moved. When he finally spoke, his voice came out rough, the kind of rough that happens when someone's been holding silence for so long it comes out weighted. How long have you known? Ashley was already pulling up the imaging from 3 days prior, the initial chest X-ray that showed only mild cardiac silhouette enlargement, the kind of finding that got labeled unremarkable because the radiologist wasn't looking for what Ashley recognized. She pulled up another image. Then another. Her hands moved with the calm of someone accessing training that shouldn't be in any official record. Since he arrived, Ashley said quietly, the constellation didn't fit mitochondrial disease. The pattern fit pericardial effusion with early tamponade. And 20 doctors missed it. 20 doctors weren't looking for it, Ashley corrected, still navigating through the digital archive. They were looking for the diagnosis they expected. That's not incompetence. That's just how the human brain works. We see what we believe we'll see. Commander Hayes was quiet for a long moment. Then, what happens now? Now we wait, Ashley said, and there was something in those 2 words that made the commander's breathing change. Not wait for Dr. Sterling to have an epiphany. Not wait for a miracle. Wait for something specific. Pericardial fluid accumulates slowly. When it starts to compress the heart, it happens fast. His diastolic pressure dropping 4 points means the compression is progressing. The electrical alternance on the monitor means it's probably already impacting his cardiac output. How much time? Ashley pulled up Marcus's latest labs. Creatinine elevated. Lactate slightly high. Hours. Maybe less. Once the tamponade becomes acute, when the fluid pressure exceeds his right atrial pressure, he'll decompensate rapidly. Blood pressure will drop. Oxygen will drop faster. Then it becomes a cardiac emergency. And if you intervene before that happens, then I'm practicing medicine without a license, Ashley said simply, and I lose my RN. If I'm wrong, I kill him myself. If I'm right and do it anyway, I'm still finished here. Commander Hayes turned his head toward her, voice with the precision of someone who'd navigated by sound and echo his entire adult life. When he spoke, his voice came out steady, the kind of steady that comes from having already made impossible decisions under fire. You were in Baghdad. It wasn't a question. Ashley didn't answer. Instead, she set down her tablet and turned to adjust Marcus's blanket, her hand steady as a surgical laser as she checked his peripheral for, confirmed the line was patent, assessed his skin turgor. Every movement documented. Every observation stored in the chart. Everything visible to anyone who knew how to read the narrative between the medical terms. I know that look, Commander Hayes continued. I know that precision. My unit had a combat medic, senior chief petty officer, same rank structure as the Navy. She had hands that moved like that. Moved like yours. He paused. She was given up on too. By a lot of people who thought they knew better. Ashley didn't respond, but her hand slowed by half a second, the only involuntary reaction she allowed herself. When the time comes, Commander Hayes said, voice low enough that only Ashley could hear, you do what needs doing. Don't ask permission from people who've already decided you're beneath them. At 14:52, Marcus's oxygen began its descent. 94 to 93 in 3 minutes. His heart rate climbed to 107. The diastolic pressure dropped 2 more points. Ashley was charting vital signs every 60 seconds now, a frequency that should have triggered questions but didn't because Dr. Sterling was in the surgical lounge and the resident assigned to the floor was drowning in admissions from the ER. The monitors showed the math of cardiac physiology accelerating toward crisis. Every heartbeat more labored than the last. Every breath shallower. The fluid around Marcus's heart was tightening like a fist, and nobody in the hospital except one nurse and one Marine commander understood what they were watching. At 15:19, Marcus's lips began to pale. Not blue yet, just the first gradient of oxygen debt beginning its visible march through his tissues. Ashley made her decision the way she'd made them in Baghdad, not with hesitation, but with full knowledge of cost. She moved toward the supply cart, pulled the ultrasound unit from its charger, and positioned it at Marcus's bedside. Her fingers found the landmarks of his xiphoid process by touch alone, the small ridge of bone at the base of his sternum where the ribs converged. where the path to his heart became accessible. "Commander," she said quietly, "I'm going to need you to stay exactly where you are." He didn't move. Ashley swabbed Marcus's skin with chlorhexidine, the sharp chemical smell cutting through the ambient hospital antiseptic haze. Her hands were steady as she positioned the ultrasound probe, watching the screen come alive with the architecture of a child's heart compressed by straw-colored fluid. The pericardial sac was distended like a water balloon reaching its limit. Another millimeter of accumulation and the right atrium would collapse completely. "How long have I got?" Commander Hayes asked. "Minutes," Ashley said. "Maybe 10. She held up the spinal needle, a 22 gauge, slender as a hair, the kind of instrument that had no business entering a cardiac sac but was sometimes the difference between life and a parent identifying a body. She angled it toward the probe's visualization window, watching the needle tip approach the fluid pocket below the xiphoid process. "If I'm wrong about this diagnosis," she said, voice level, "I perforated his heart. If I'm right and stop, he dies from tamponade. If I'm right and do this, I just became an unemployed criminal." "Do it," Commander Hayes said. Not a request. Not a question. A command from someone who understood that paralysis was the only unforgivable choice. The needle advanced. Ashley's eyes tracked the ultrasound image, the needle tip approaching the fluid, sliding between the chambers and the pericardial wall, the years of combat medicine in her muscle memory translating to civilian anatomy with horrifying precision. She aspirated. Nothing. She adjusted angle by 4 degrees, following the ultrasound guidance. Nothing. A third adjustment, and the syringe suddenly filled with straw-colored fluid, 60 milliliters of accumulated pericardial effusion that had been slowly murdering an 8-year-old boy while 20 different doctors debated diagnoses they didn't actually see. Marcus's chest heaved. His oxygen climbed, 88 to 91 to 94 to 97 in 8 seconds. His heart rate dropped from 112 to 98. The electrical alternance on the monitor vanished like it had never existed. His lips pinked up like someone had suddenly turned the saturation back on in the world. Ashley withdrew the needle, applied pressure with sterile gauze, and monitored the vital signs as they stabilized into the range of a healthy 8-year-old child. The room door opened. Dr. Sterling stood in the frame, fresh from surgery, surgical cap still in place, scrubs still visible beneath his white coat. His eyes moved from Ashley to the ultrasound unit to the pericardiocentesis kit to Marcus's monitor showing stable vitals to Marcus himself, breathing easily, his color restored. The progression of recognition crossed his face in 4 separate stages: confusion, then understanding, then the slow realization of what this meant for his reputation. His expression went white. Then red. "What the hell have you done?" His voice came out high, the medical authority stripped away, replaced with raw panic. Ashley met his eyes. One measured breath. Hand still steady on the gauze, still monitoring, still in full clinical mode. "I saved his life." Dr. Sterling pulled out his phone before the words finished landing. His fingers were already moving across the screen, no hesitation, no second thought, just the automated response of someone watching his carefully constructed narrative collapse and reaching for the only tools he had left: authority, institution, the crushing machinery of professional consequence that had worked on everyone else he'd ever threatened. Commander Hayes' hand found Ashley's shoulder. Not a threat. Not a warning. Just a weight, solid and present, the kind of weight that comes from someone who's already decided which side of history he was standing on. The hospital suddenly felt very small. Marcus's lips turned blue. Just a thin line at first, then spreading across his mouth like a shadow. The heart monitor that had climbed so steadily 3 minutes ago suddenly flatlined its rhythm. 82%. His oxygen saturation was collapsing. Ashley was 3 rooms down when she heard it, not the alarm itself, but the silence that came before it. That specific quality of air pressure dropping. She was moving before the code blue alert activated, her body already committed to a direction her conscious mind hadn't finished processing. Muscle memory. The kind that doesn't ask permission. The pediatric monitors screamed. Red numbers. Falling. Ashley pushed through the doorway and saw it in one glance, the boy's chest rising and falling but getting no purchase, his small body working hard for air that wasn't reaching his blood. The cardiac rhythm on the monitor was rapid, chaotic. Not the steady climb of a child waking up. This was arrest territory. Dr. Sterling's voice came from the hallway. "Page cardiothoracic. Get me 2 4s," and he stopped in the doorway. Saw Ashley already at Marcus's bedside, her hand steady on the boy's shoulder. Saw her reading the monitors the way other people read newspapers. Saw her looking at something no one else in the room could see. "Pericardial effusion," she said. Not a question. A diagnosis delivered with the flat certainty of someone who had already made the decision about what came next. Fluids compressing his heart. His intamponade. Dr. Sterling moved forward. "I'll take it from here." "Step." "No time." Ashley's voice dropped an octave. It wasn't rude. It was final. The kind of voice that people in combat listen to. Commander Hayes, standing in the doorway behind Dr. Sterling, recognized it immediately. He stepped back. Ashley's hands were already moving toward the ultrasound machine, the portable unit kept in the pediatric section for exactly these kinds of emergencies. "I need a 25-gauge spinal needle. Now." Not a request. Not from a nurse asking permission. A command from someone who knew exactly what she was doing. The resident froze. Dr. Sterling's face reddened. "Nurse Cooper, you do not have sinus rhythm or cardiac arrest in 90 seconds. Ashley glanced up from the ultrasound screen. "Your choice, doctor. Speak now or get out of my way." Commander Hayes reached past Dr. Sterling and handed her the needle from the emergency cart. His hand was steady. His faith was absolute. He had seen this before, not the procedure itself, but the certainty. The kind of certainty that keeps people alive in places where hesitation kills. The ultrasound screen glowed. Gray shapes resolved into clarity. There, the dark collection of fluid surrounding the heart muscle. The effusion pressing down like a weight. Marcus's own body turning against him while 20 doctors had looked at test results and called it irreversible. They hadn't looked at the right things. Or they hadn't known what to see. Ashley prepped the skin with betadine. The smell of it, sharp, medical, the scent of 100 emergency interventions, filled the small room. Her hands moved with the terrifying precision of someone who had done this before. Not in this sterile pediatric bay. Somewhere else. Somewhere the stakes were higher and the tools were worse and the margin for error was measured in seconds. The needle went in at the 4th intercostal space, mid-clavicular line. Textbook positioning. Her left hand guided from the ultrasound image while her right hand held the needle with the kind of steady pressure that comes from neural pathways carved by repetition. Baghdad. FOB Shank. A trauma tent where a Marine with a sucking chest wound had looked at her and asked if he was going to make it. She had told him yes. She had made it true. The hiss of air escaping. The pressure relieved as the needle tip found the collection. Clear fluid flowed back through the needle, draining away from the heart like rain falling in reverse. "Aspiration protocol," she said, not looking up. "Catch it." The resident held the collection tube. For milliliters. Then 8. Then 12. With each withdrawal, the cardiac monitor's rhythm smoothed. The chaos resolved into coherence. The electrical noise settled into the steady, solid thump of a child's heart that suddenly had room to beat again. Oxygen saturation climbing. 90. 92. 95. Marcus's chest rising and falling with actual purpose now, the air flowing where it needed to go. His lips pinking up. Color returning to his face like someone turning up the saturation on a photograph. 98%. Stable. The room breathed. Everyone in it had been holding air in their lungs without realizing it. Dr. Sterling stood frozen in the doorway, watching. The equation had just recalculated in real time. The boy who was supposed to be irreversible, whose case was supposed to validate his clinical judgment, was suddenly breathing steadily on a pallet that shouldn't have worked. A blind child, the son of a Marine commander, whose life had just been saved by a nurse named Ashley Cooper. Ashley withdrew the needle and applied pressure at the puncture site. Routine. Practiced. The way a mechanic might check the oil in a car they've been servicing for 3 years. Admit him to PQ. Cardiac monitoring every 15 minutes. I want serial chest films every 4 hours to confirm no reaccumulation. She glanced at the resident. Did you get that? Yes. Yes, I. Ashley peeled off her gloves. Caught Commander Hayes's eye. Saw the blind man's son breathing steadily in the bed, the monitors showing vital signs that contradicted everything 20 doctors had agreed upon. Saw the recognition on Hayes's face. Not gratitude exactly. That would come later. Right now it was something older. Respect from one warrior to another. His stable, she told the commander. Her voice had returned to its normal register, but something in it had shifted. Something that couldn't shift back. The effusions drained. His heart has room now. Surgery can wait until morning if cardiothoracic wants to scope for the source. But right now, his stable. Commander Hayes nodded. Once. Precise. Military. Then, thank you, Senior Chief. The title hung in the air like something that had been waiting 14 years to be spoken aloud. Ashley didn't respond. She was already turning away, moving through the motions of documentation. The monitor continued its steady beep. Rhythm normal. O2 sat 98. Blood pressure responding. The boy would live. The diagnosis that 20 doctors had declared irreversible had been reversed in 40 seconds and a spinal needle. But that wasn't the worst part for Dr. Sterling. The worst part was watching Marcus Hayes breathe steadily while he stood in the doorway, understanding, finally, that he had just been upstaged. That a nurse had done what he couldn't. That institutional power meant nothing when measured against actual competence. Dr. Sterling's face was the color of old concrete. He turned and walked toward his office without a word. Behind him, in the hallway, Ashley could hear his voice through his office phone before she had even made it back to the nurse's station. Get me the board members. All of them. I don't care if they're in surgery. Tell them we have a critical situation at Oak Creek. The calls would follow. The network activation. The phone tree of administrators and colleagues and board members who all owed Dr. Sterling favors, or feared him, or believed him when he told them stories about ambitious nurses overstepping their scope. She had maybe 30 minutes. Maybe an hour. But Marcus was breathing. Within an hour of Marcus breathing steady again, Dr. Sterling's hands moved with surgical precision, not to save lives, but to end one. He stood in his office with the door locked, phone already at his ear, his voice smooth as silk over steel. Richard, it's Sterling. Oak Creek Memorial. We have a situation. The first call went to a board member with a country club membership and a consulting contract. The second to a hospital administrator with political ambitions of his own. The third to a colleague at Presbyterian who owed him a favor from a malpractice case 5 years ago. A rogue nurse, he said into each phone. Practicing medicine without a license. Emergency pericardiocentesis. Unsupervised. She could have killed him. Each call lasted less than 3 minutes. Each one planted the same seed: liability, risk, danger. By the time he hung up the third phone, the machinery was already turning. The state licensing board took the call at 2:51 p.m. A formal complaint arrived by encrypted email at 3:15 p.m. Sterling's signature on the complaint was forged. He perfected the technique years ago, but the words were his own. Nurse Ashley Cooper performed invasive cardiac intervention beyond her scope of practice without physician authorization or supervision. Patient outcome was fortuitous, not competent. Recommend immediate credential audit and temporary suspension pending investigation. The board flagged the case as high priority. A nurse performing a physician-level procedure was exactly the kind of headline they moved fast to contain. By 3:45 p.m., they'd assigned an investigator. Her name was Patricia Kessler, and she'd built her reputation on finding incompetence in medical files. Sterling had worked with her before. He knew how her mind worked. The outside investigator arrived at Oak Creek Memorial at 4:22 p.m., her briefcase containing subpoena authority and the kind of access that made career nurses nervous. Sterling had briefed her by phone before she arrived. Check her references. Something doesn't add up. Nobody learns pericardiocentesis in nursing school. Kessler nodded, made notes, and began pulling files. Ashley's personnel jacket showed a nursing degree from University of Colorado, certifications from the American Heart Association, 3 years of clean employment reviews. Nothing suspicious. Nothing hidden. But Kessler was looking for shadows, and Sterling had taught her exactly which files to question. The technique itself, he'd said on the phone. That level of precision doesn't come from textbooks. Where did she really train? Kessler made a note, background inconsistency. At 5:48 p.m., security received a call from the hospital administrator. Escort Nurse Cooper from the building. Her personnel file is under investigation. She suspended pending review. No discussion. No hearing. No explanation beyond 3 sentences delivered through a chain of command that didn't question orders. 2 security officers appeared at the pediatric unit at 5:12 p.m. Neither looked at Ashley's face. One held a cardboard box. The other gestured toward the locker room. "Bring your things," the first one said. 9 words. That was all it took. Ashley packed slowly, each item deliberate. The cracked World's Best Mom mug Jacob had made in 3rd grade, the glue holding the handle together yellowing now from 5 years of hot coffee. A small pothole succulent, leaves browning at the edges from neglect and fluorescent hospital lights, its ceramic pot chipped on one corner. Her uniform jacket, folded precisely along the seams. And at the very bottom, hidden in a zippered pocket, a photograph. Her SEAL team at FOB Shank, Baghdad, 2009. Faces she'd saved. Faces she'd failed to save. Names she'd been ordered to forget. She'd kept the photo face down in her locker for 3 years, tucked behind her spare scrubs where no one would question why a pediatric nurse carried a military unit photo. Now she turned it face down again before placing it in the box, as if the photograph itself might betray her. The security officers waited by the door. No eye contact. No words. Professional distance. The kind that made clear they'd been instructed not to speak to her, not to acknowledge her as anything other than a problem to be removed. Ashley picked up the box. It was lighter than she expected, everything she'd claimed in 3 years of working at Oak Creek Memorial fitting in something designed to hold reams of paper. She walked past them, past the pediatric unit, past the nurses' station where colleagues suddenly became very focused on their computers and charts. Down the hallway. Down the elevator. Through the lobby where the evening shift was just arriving, families still believing their children would be healed by competence and compassion. The rain started as she reached the bus stop, a cold Denver drizzle that soaked through her scrubs in minutes. She stood under the overhang, cardboard box growing soft against her body, watching headlights blur through water on the cardboard like a watercolor painting dissolving. A bus pulled up. She didn't board it. Another came 15 minutes later. She let that one pass too. The rain hammered harder, and she stood motionless, her military posture unchanged, her jaw set in that particular way that comes from having already survived the worst the world has to offer. A man waiting beside her shifted uncomfortably and moved away. She didn't notice. Her eyes were fixed on the wet pavement where her reflection flickered in the streetlight. She'd been erased before. Once in Baghdad, when Operation Copper Dawn was declassified, or rather, when it was UN declassified, when certain names were deleted from official records, when her service was buried under classified stamps and legal threats that promised federal prison to anyone who spoke her name in connection with 17 hostages extracted under fire. The paperwork had been pristine. Her entire military record, 3 Navy Crosses, 2 Bronze Stars with Valor, a Purple Heart, simply moved into a file marked eyes only and filed away like she'd never existed. They'd given her severance, a new social security number, and a warning the erasure was necessary for national security. Speak of it, and federal agents would arrive at her apartment within hours. The threat had been delivered by a 2-star general who'd shaken her hand afterward, his grip firm, his eyes saying what his mouth couldn't: "I'm sorry. Thank you. Forget everything." Now she was being erased again, but this time by a man with a golf handicap and a need to protect his reputation. The rain fell harder. The cardboard box was coming apart, the bottom corner softening, her cracked mug visible through the wet paper. She could have gone inside. Could have taken the bus. Could have called Jacob and told him she'd lost her job, told him some version of the truth that didn't require explaining why a surgeon-level procedure had come so naturally to her hands, why she'd known exactly where to insert the needle, how to read the ultrasound markers, when to stop. Could have let him hear the tremor in her voice that would come if she spoke for more than 3 words. But she didn't tremble. That had been trained out of her 14 years ago in a desert where trembling got people killed. Instead, she shifted the cardboard box to her hip and stared straight ahead at the rain, at the blurred headlights, at the city that didn't know her name and would never need to. Twice erased. Once by the military that had made her invisible for the sake of policy. Now by a doctor who'd made her invisible for the sake of ego. The difference was that this time, someone had seen her do it. Someone had watched her save a child. Someone was going to remember. The rain kept falling, and the bus stop stayed empty except for one woman and a cardboard box coming apart at the seams, containing everything she'd built in a civilian life and nothing of the person she actually was. What happened next would demand more than just compassion. It would demand the kind of courage that walks into institutions and demands the truth be spoken aloud. But that reckoning was still hours away, still waiting in dark offices and urgent phone calls, still moving toward Ashley like a convoy through Baghdad at dawn. The stories we tell matter. If you've ever been underestimated by someone with power, if you've ever been dismissed and proven right, if you've ever wondered whether the truth matters more than ego, comment below. And if you believe that real courage often looks quiet, click subscribe. Because the heroes we don't see are often the ones saving lives in the dark.